Okay, I think we're recording. Do you have a notification that we're recording? Okay, great. Thank you so much. Hello, and joining us today for today's One for the Ages lunchtime presentation. So all this year, Scripps is hosting monthly lunchtime presentations in celebration of our 100th anniversary, and I'm excited to be speaking with you today. I'm Jennifer Heston-Mullins. I'm a research scholar with Scripps, and I've been a licensed social worker in Ohio for 24 years. Prior to going into research, I worked with elders and their families and friend care partners for 16 years within the long-term care services and support system. I was also a care partner for 3 of my grandparents, one of whom lived with dementia. So I have both a professional and personal interest in caregiving. And today I'll be talking about Our Family, Our Way, and you'll also hear me abbreviated as OFO. It's a communication and care coordination resource for caregiving families that was developed here at Scripps. And first, I want to start off by acknowledging the RRF Foundation for Aging and the Ohio Long-Term Care Research Project, who provided support for the development of Our Family, Our Way. And I also like to acknowledge the leadership of Dr. Kathy McGrew, who initiated the original Our Family, Our Way work that I've been privileged to continue. So we are extremely grateful to her, and she's with us today and joining, so we're glad to have her here. I'd also like to acknowledge the Scripps research staff and the students who have been part of the OFO development at different times since 2016, actually, when this version of the project was conceived of. Erin Kelly, Natasia Hicks, Abby Helsinger, Sarah Hackett, Valerie Flores, and Reese Moore. The many and valuable contributions of these individuals were instrumental to the development of this resource. I'm going to start off with providing some context for the caregiving situation we currently have in the US. This infographic has a lot of information on it, and it comes from a report called Caregiving in the US 2020 that was recently published by the National Alliance for Caregiving and AARP. These 2 organizations have been publishing caregiving in the US reports every 5 years since 1997. And according to the 2020 report, the number of Americans providing unpaid care to an adult or child with special needs has increased from 43.5 million in 2015 to 53 million in 2020. Nearly 20% of those are providing care to an adult with health or functional needs. And among those caring for an adult, there have been increases in the number who report caring for more than one person, those who say they're having difficulty coordinating care, those who care for someone with Alzheimer's disease or dementia, and those reporting that their own health is fair to poor. The largest proportion of those providing care to adults are boomers, with Gen Xers not far behind, and a growing number of millennials and Gen Zers are also providing care. To give a little context to that, my parents, who are in their early 70s, are considered boomers. I'm a Gen Xer in my mid-40s, and my 17-year-old daughter is Gen Z. So we have generations, multi-generations that are providing care right now, and growing numbers of younger caregivers as well. So family and friends are vital to our care and support systems, and providing care often when no formal services are in place, and also serving to fill gaps that our formal services cannot cover. To highlight their importance, researchers have estimated the monetary value of the care they provide to try to show what their value of what they're giving the country is. In 2017, they estimated about 41 million caregivers in the United States provided an estimated 34 billion hours of care to an adult with limitations in daily activities. The estimated economic value of their unpaid contributions was approximately 470 billion in 2017, based on those 41 million caregivers providing an average of 16 hours of care per week at an average value of $13.81 per hour. There's currently only one source of dedicated federal funding for caregivers called the National Family Caregiver Support Act. And the NFCSP was passed in 2000, and it contains limited funds, which are distributed through grants to states and territories, using a formula based on the number of individuals age 70 and older in those areas. And in most states, the NFCSP services are administered by the area agencies on aging, and they provide information to caregivers about available services, assistance to caregivers in gaining access to the services, individual counseling, organization of support groups, and caregiver training and respite care, and supplemental services on a limited basis. In 2016, a report was published by the National Academies of Science, Engineering, and Medicine containing a series of recommendations proposed by experts in geriatrics, gerontology, psychology, and public policy. The report called upon federal departments to create a national family caregiver strategy, to expand caregiver support systems and programs, to establish a public-private multi-stakeholder innovation fund, and to address the diversity of family caregivers. There have been some recent federal efforts to address family caregiving that grew out of the Families Caring for an Aging America report. In January 2018, the Recognize, Assist, Include, Support, Engage, otherwise known as the RAISE Family Caregivers Act, was signed into law, and it authorized the Department of Health and Human Services to establish and maintain a family caregiver support strategy. A similar act, the Supporting Grandparents Raising Grandchildren Act, was passed in 2018 with a focus on kinship care. And a Grandparents Raising Grandchildren Advisory Council has been created, and their goal is to develop a report that provides best practices, resources, and other useful information. And also there is an advisory group related to the RAISE Family Caregivers Act. It's important to note, though, that neither of these acts carries new funding, and they do not create any new initiatives or programs. However, both acts have published initial reports this past year. So in September, the RAISE Family Caregiving Advisory Council released its initial report to Congress, and it outlines some of the challenges faced by family caregivers, federal programs currently available to support them, and provides 26 recommendations for better supporting family caregivers. In November 21, the Advisory Council to Support Grandparents Raising Grandchildren released its initial report to Congress, and this report outlines the joys, challenges, gaps, and unmet needs faced by kin and grandparent caregivers. It also describes federal programs currently available to assist them and provides 22 recommendations for better supporting kinship families and grand families. The recommendations from both of these reports will inform the development of the National Family Caregiving Strategy, which we can only hope will include some increased funding or some funding attached to it. But in the meantime, we know that there are millions of family and friends providing unpaid care and support who have minimal access to resources. We also know that one family member often assumes a very large proportion of the care load. According to the Caregiving in the US report, 64% of caregivers of individuals 18 and older are considered primary caregivers. 47% of those are considered sole caregivers, and 17% said that they provide most of the unpaid care. 36% were considered non-primary caregivers, and another 23% reported that another caregiver provides most of the unpaid care, 12% indicating that caregiving was shared equally, so they couldn't say there was a primary person. But it's really important to note that being a sole caregiver or care partner does not mean that there are no other potential care partners in the family. It may mean that other potential care partners are simply not involved, and in some cases are perhaps even crowded out by the activities of the primary care partner, where they're maybe making decisions and not really being inclusive. In 2014 and 15, Kathy McGrew and I worked on 2 projects that focused on family and friend care partners. They were funded by the Ohio Department of Aging and the Ohio Department of Medicaid, with the goal of including intentional caregiver assessment into the tools and practices of Ohio's Passport and Ohio Home Care Waiver programs. In those projects, we developed and refined a simple instrument for measuring the balance between caregiving stresses and strengths, where we asked care partners to rate their stress and strengths on a scale from 1 to 10, and then name the sources of those stresses and strengths. Many of the care partners we spoke with named not having any support from others as a major source of stress. However, most of them found it difficult to negotiate support from family members or others, and many said that they didn't know how to ask for help. So we developed a short tool to help care partners explicitly state what they thought others in their lives could do to help them, and then encourage them to share that tool with family members and friends. Simply put, the tool had care partners indicate what would really help, gave the other family and friends an opportunity to respond with what they could do, And then seeing the difficulty, that many care partners had in getting support from other family members sparked some ideas for further research in getting help and helping families negotiate their care and support with each other. And this little simple tool was the spark that led to Our Family, Our Way, or again, as OFO, as we call it. Our work was inspired by a belief that problems in family communication cause families to struggle with caregiving. In particular, we targeted 4 communication problems found in the family communication and caregiving literature. Not seeing eye to eye on what's needed, wanted, and possible in the care arrangement. My sister thinks that mom should stop using the stove. Mom thinks she's fully capable of using a stove. I think she could use it with some help and supervision. And my brother, who lives 2 states away, really has no idea what's going on with mom and the stove. Also, failing to acknowledge that each family member's decisions affect other family members. When my sister decides that she's just going to cook all of mom's meals, mom loses any chance to cook for herself. I give up on the great idea I had to sign her up for home delivered meals, and my brother decides it's handled and he doesn't have to worry about it. Also, doing things without talking or without actually deciding. So when my sister jumps in and starts cooking, it's as though a family decision has been made when it actually has not. And finally, when families exclude some members, it's especially difficult to achieve a good care and support arrangement. Too frequently, the first person to be left out of family discussions and decisions is the person with care needs, but others are frequently not included for a variety of reasons. So that leads us to Our Family, Our Way. So based on our experiences in our earlier projects and our personal and professional experiences, we knew that families need more help at initiating and carrying out conversations with each other about their care and support arrangements. And so that's where OFO comes in. OFO is a communication and care coordination resource that caregiving families can use to help them have a good conversation about their care and support arrangements, and it's designed for families to be able to use on their own without the help of a professional. We've developed written tools that help each family member think about their perceptions of their family's arrangement and then walk them through the process of holding a family meeting, where they create a plan for who will do what, when, where, and how. And when we use the word family or family members, we mean that term broadly to include those related by blood and also families of choice, which often include friends. The goals of OFO are to improve communication between family members about care and support, ensure that the person with care needs is included in conversations and decisions about their care and support, and increase the involvement of family members and others so that one care partner is not responsible for all care and support. OFO works like this. So each member of the family, including the person with care needs, fills out a set of individual tools that helps them think through and write down their unique perspectives on the care and support arrangement. After everyone in a family completes their individual tools, the family determines a date, time, and place for a family meeting. There's a family meeting guide that walks the family through the process of holding their family meeting. Prior to or at the beginning of the family meeting, family members review each other's completed individual tools, and then they engage in a shared assessment where they compare what they wrote in their individual tools and talk about where their answers differ and why. Then they work to negotiate those areas of difference or identify places where they just can't agree. Finally, they develop a family care and support plan, and they think about a follow-up plan for ongoing communication and for making changes to their arrangement as needed. This is a slide that's a snapshot of some of the sections included in the individual tools. So there are 2 versions of the individual tools, one for care partners and one for the person with care needs, which has the same sections, but with slightly different wording. This is a snapshot of the person with care needs version. Family members use check marks and notes to note spaces here to indicate their perception of the current care arrangement in terms of the person with care needs health considerations, their home environment, and the care and support activities that they require assistance with. This is a snapshot of the shared assessment, which has the same sections as the individual tools. Families go item by item, discuss their different answers from their individual tools, try to reconcile their different perspectives and reconcile their differences, and then record the outcomes of their discussion. And because reconciling differences is not always possible, the shared assessment also involves and includes a can't agree column, as you can see over to the right. This is a snapshot of the family care and support plan, where families record their plan for moving forward with their arrangement, identifying what steps they might take to address an issue, who's going to take the lead, who else is going to be involved, and when they will take the steps. Here also, there's an option for the family to indicate that they cannot agree or are still undecided on a particular item. And then these unresolved areas become part of their follow-up plan. Talking about care and support might open a can of worms in some families and bring light to sensitive or painful issues that might need to be resolved before the family can move forward. To acknowledge that risk, we built in these stoplight features throughout the guide. They're just a simple reminder to help families check in, to pace themselves, and give them permission to take a break or stop the process altogether and involve a professional if they feel like that's needed. And then at the end of the family meeting, the family decides, how do we want to communicate with each other going forward? What is our plan for doing so? How are we going to update what's needed and wanted and possible in our arrangement? When are we going to meet again? And what are the areas where we're undecided or can't agree right now? And make a plan to meet again and discuss and talk about those. So the original version of the family meeting materials were developed with support from the RRF Foundation for Aging during a pilot study with a small number of families. Here are some things that they shared with us about how OFO was helpful to them. The first quote here at the top left was from a primary care partner. It helped identify the load that I have on my plate and bring awareness to everything I do. Putting it down on paper allowed everyone to see that. A common response was the helpfulness of the structure of OFO. And this quote is from a care partner over here to the right. It's a structured process. It forces you to think about these things, not at random, because you may forget things that we aren't aware of. And then the last quote here is from a person with care needs when asked about how OFO was helpful. Being able to see how the caregivers look at the same situation I'm looking at. This is also a quote from a person with care needs. For me, I think it took things that were kind of here, there, and everywhere. And I guess the picture I have is taking a funnel and putting it all in there and having it synthesized and put in a proper order so that you can look at it, think about it, and come to conclusions, one or more than one person. For all of the families in the pilot study, it was the first time they'd sat down and had a purposeful discussion about their arrangement. Their communication was more inclusive and explicit, and the inclusion of the person with care needs also had an impact for those families. Some care partners were surprised to learn that the person with care needs' view of the situation was different from their own, even in families that thought they had very good communication going into the project. The individual tools exchange and the shared assessment seem to have the greatest impact on families. This ability to think about the process by yourself and then compare your perceptions with other members in your family. Some people gained new insights into how much others were actually doing that they weren't aware of before. And some were surprised to realize that actually others were more tuned in and did know more than they thought they did about the situation. And we found that families made plans to continue having discussions about care and support, which was a really great thing. Two sets of quotes here encompass many of the family communication processes that we targeted in that pilot project. So here, a mother and her son, her primary care partner, talk in separate interviews about the care and support arrangement. Here's what they had to say before they completed the individual tools. The son said, "We never really did sit down and plan how we were going to deal with mom's aging and who was going to take care of her. And I guess I was kind of available and willing to do it. So pretty much that's the way it played out. It was never just a conscious decision and we never really discussed it. It kind of evolved and happened." The mother said, "It's hard to explain because when my son first came, he came from another state to be closer to the family. It was like he inherited the job. Nobody asked him. Everybody assumed because he was here, he would do it. But it wasn't like a one-on-one, like, can you do this? Nobody consulted with him or myself. After the family meeting, they had this to say. The son said, "We really weren't communicating. Everybody was just assuming. The feeling was pretty much, it's getting done, so what's the problem? You know, out of sight, out of mind. I think with these kinds of things, I think the big thing is getting people to realize there is something going on here and maybe we need to address it and look at it." And the mother said, "The family meeting was an open session. They talked about their answers openly. To me, it was very much revealing and proves to me that the family could work together. I felt that each one wanted to wholeheartedly do something, but had no guides or leadership before." In the pilot, there was a general embrace of the person with care needs role in discussions about care and support in the family meeting. And persons with care needs reported that they felt affirmed and heard. One person with care needs said, "It brought to light what I was thinking and what they were thinking, because usually I don't converse that much about myself with them." And a care partner said, "We need to talk more often amongst ourselves about that, including mom. How is she doing? Is she getting what she needs?" One family with 5 adult children made significant changes to their care and support arrangement. In this family, the primary care partner was a son who stopped working and moved in with his mother to provide care for her 24/7. During their family meeting, this family decided upon several things. First, the other family members agreed to increase their time with their parent and provide the primary care partner with a day off each week. All of them agreed that the primary care partner would receive the lion's share of assets upon the parent's death as compensation for him ending his employment to care for her. And they all agreed that family members who were the least involved in care and the least involved in what was going on a day-to-day basis would be informed about, but not necessarily included in day-to-day decisions about care. And this family immediately started following through with these changes. When we followed up with the family several weeks later, the legal documents had been executed to leave the house to the primary care partner upon the parent's death, and family members reported checking in with the primary care partner to see if he wanted to take a break. Based on our initial pilot evaluation, these were the core features of OFO, of the process that facilitated positive outcomes. This individual owning of perspectives about what's needed, what's happening now, what's wanted, and what's possible. The fact that folks had the opportunity to really think about what they thought and how the situation was affecting them, and then own that perspective coming into the family meeting. This coming together in a structured way, actually intentionally setting up time to talk with each other about these issues, and including the person with care needs. Engaging in a negotiated assessment by confronting and reconciling the differences that they had in their perspectives. And then also the expectation that something positive and helpful was going to happen as a result of the family meeting. That was important to the success of the process. And so following the pilot, we received some additional funding from the Ohio Long-Term Care Research Project to make revisions and refinements to the family meeting materials based on the feedback from our pilot participants. And so we created a website to house the materials, and some additional resources for families came out of that time. So this is some instructions for downloading and printing the materials, some videos, some tip sheets, a helpful resources booklet, and a sample agenda for follow-up meetings. So recognizing that some families may not be familiar with downloading, saving, and printing, we created an instructional video to walk them through the process. We also created a preparing your family meeting materials document that introduces the OFO process and the materials and shows users how to navigate them. So this was, I'm not going to play it, but this was just a little video that was created that actually walked someone through the process of clicking on the website, clicking on the materials, downloading the materials, saving the materials, filling out the materials, all of that together. And then the document here mentioned just kind of how do you walk through these materials, because there are several different excuse me, family meeting materials. So it talked about where the page numbers were located in the documents, also the fact that the name of the document that you're in appears right next to the page number. This was helpful also as people were printing and downloading. So we were trying to be mindful of the fact that not all families are particularly tech savvy, because this was going to be made available online, but they could print and download those materials. We wanted to provide a little extra instruction for those individuals who might need it. We also did 2 videos. Some of the pilot families suggested that videos talking about why a family meeting might be helpful and how to conduct one could be helpful in getting buy-in from some family members who are reluctant to engage with the process. They said, I'll never get my brother to read something about this, but if I send him a video link, he might watch a short video, and maybe that'll pique his interest a little bit. So we worked with a video development company and put together 2 videos. What can a family meeting do for us? And how do we hold a family meeting? And there were some we went through a really interesting process in developing these videos, which was almost an entire other presentation of trying to get representation in these videos that was not terribly ageist and to get some diversity within the videos as well. So sometime that's a whole other conversation. That's kind of an interesting one to have, but it is 2 resources that we have available now. We also put together a helpful caregiving resources booklet that highlights the area agencies on aging as great sources for information and provides national resources. Because OFO is a resource that's available across the country, we could not be too specific with local resources, but we wanted to make sure people knew where to go to find the local resources in their area. The booklet is also equipped with web links. So if you're in the PDF form of it on the computer, you can click on those web links and it'll take you directly to those organizational websites. And we also made it a point to include resources targeted at care partners, but also to locate some resources targeted to persons with care needs, such as support groups and online community forums. There's also the sample family meeting agenda. This gives families some idea of what to cover in subsequent family meetings, whether or not they use the whole OFO process and materials. And in 2020, we received additional funding from the RRF Foundation for Aging to test the OFO process and materials with a national sample of caregiving families. Unfortunately, just as we were beginning recruitment, the COVID-19 pandemic hit us, and our ability to recruit caregiving families was significantly affected. So we had to switch gears a little, and it ended up being an opportunity for us to address something that we had always dreamed about as future work for our team. Now, up to that point, our work had not specifically addressed individuals living with dementia and their families because there were doubts about how we could retain the core feature of including the person with care needs in the family meeting process if they were unable to use the family meeting materials as designed. So with support from RRF, we engaged dementia subject matter experts, professionals working with individuals with dementia and their families, and individuals living with dementia and their care partner as reviewers. So we gave them access to the OFO website, and they reviewed the materials and provided feedback about how the process and materials could be more inclusive of people with dementia and the needs of their families. They provided some really valuable insights that resulted in additional revisions to the family meeting materials, and also in the creation of some new OFO resources. From the beginning of our OFO work, there had been discussions in our team about using the term care partner versus caregiver. And so when asked to react to those terms, individuals with dementia and their family members affirmed that care partner was their preferred term. They also reported that they liked the simplicity and the logical layout of the OFO website and that it was easy for them to navigate. Our subject experts and professional reviewers did express concerns that the materials and the process were too complex for most individuals living with dementia to utilize, and suggested that we develop some sort of simplified tool to include their input. And individuals with dementia encouraged us to recognize and acknowledge that care and support is not just someone's physical and health needs, and that social engagement is also an important and perhaps the most important piece. So this first quote is from a person living with dementia at the top left here. Throughout, you use caregiver, caregiver, caregiver. Care partners is really what it needs to be. And I think even more so important in this document because you're trying to build a team. You're trying to get all people involved. So therefore, all should be partnering with the person with care needs as well as with each other. And the second quote is from a care partner. I think as a care partner, I like partner better than caregiver. I like that role better. We're partnering in this. It's not just you. We're partnering and we're together. I'm cheering for you. This quote is from a person living with dementia. I think the number one prescription doctors should be giving a person with a dementia diagnosis is social engagement. I think anyone who's having to go through this process, social engagement needs to be highlighted. What are we doing to keep the individual connected, engaged in meaningful activities? This is a quote from one of the dementia subject experts that was a reviewer for us. I see a lot of use for this process in the beginning for families that are able to say, at some point, we're going to need extra help in your care. We'd like you to be involved now in talking about what's important to you and how you receive care. Is this something that you can have assistance with? Is this something that you don't want assistance with? Looking at the future when they're not in a crisis situation. For families, that would make that step to do that. What a gift to be able to have that information and know exactly what the person wants and what's important to them. That would save so much stress. So a couple of new materials, new resources came out of that, this feedback by our reviewers. The All About Me document borrows from work conducted by Scripps researchers in 2016 and 17 that resulted in the What Matters Most guide. This was a tool that was developed for Ohio's Passport Medicaid waiver programs for gathering and organizing information to guide the delivery of person-centered care at home. So All About Me recognizes that family members and friends may know each other well, but there are some questions that we typically don't ask each other. And this resource is designed to help care partners get to know what's most important to the person with care needs and their preferences for certain aspects of care and support. Not only can this information be helpful in guiding family and friend care partners, but it can also be useful to paid care partners who may become part of the arrangement. And it can be used in an interview format, or the individual themselves can fill it out if possible. And it provides kind of conversation starters. You know, if you were meeting someone for the first time, what's the most important thing they should know about you? What are your favorite things to do? How do you like to spend your time? And then it also asks questions specifically about different types of care preferences for how would you like to be assisted with bathing? What's important about how you take care of your mouth, or how we should take care of your mouth or your oral health? What's important about getting dressed and undressed, or the types of clothing that you like to wear? So the design here was also as if an individual living with dementia, or for other reasons as well, could not perhaps participate fully in the family meeting process, could this resource then be used to bring their voice and their preferences into those conversations about care and support? We had developed some tip sheets earlier on, and the feedback from our reviewers resulted in 2 new tip sheets. So they were, should the person with care needs attend the family meeting? And how can I provide meaningful support from a distance? And these tip sheets are basically just a two-sided, one-page, two-sided, that has some different tips on these different topics. So, you know, who should be involved, preparing for the family meeting, some general communication tips, dealing with major differences in the family meeting. These are just quick items for people to be able to take a look at and utilize. There was some concern, certainly among our professional reviewers and our subject matter reviewers, that it would be very difficult for some individuals to attend the family meeting, particularly individuals living with dementia. And how could we help families kind of walk through a process of deciding when it might actually be harmful or counterproductive for someone to attend these conversations, even though we always value having that person involved in the process whenever possible. So some of these tip sheets just kind of walk people through thinking about that and how that might work. Even though OFO was designed and is designed as a self-guided resource or a family-guided resource, we also developed a guide for professionals who might want to use OFO in their work with caregiving families. And so we gave some tips and suggestions for how to utilize OFO materials in their process with different types of families. So there may be families who don't have access to a computer, Wi-Fi, or printer. There are those families that can use OFO as a self-guided resource. Some families are skeptical about the usefulness of holding a family meeting, and we have some resources we indicated in there as to, if you have someone who's skeptical, point them to these particular resources and that might be helpful to them. Families that are eager but just not sure how to get started. Some families that might need coaching to stay accountable, so they can go through the process, but they might need someone to kind of check in on them at different points in the process to make sure that they're on track and they're actually following through with their intention to hold a family meeting and utilize the materials. And then also there are some families who need facilitation during their family meeting. This is not something that, because of perhaps past traumas or deeper family conflicts, they really need someone there to actually guide them through the process, and these materials could be used in that way as well. So we have a guide for professionals to look at that. We also created some social media graphics and flyers to help organizations and family members and whoever wants to spread the word about OFO, and those are available on the website. Just kind of some, this is what it's about, how do you get a hold of it, how do you access the materials? And then everything that we've created is available for free and to download from the OFO website. And this was a really important feature for our team, that this be an easily accessible and freely available resource for caregiving families. And there's a built-in feedback feature on the website. I'm going to show you the website here in just a moment, that you can actually give feedback through a couple of online surveys that we've created. So I'm going to end the show for just one moment because I want to show you the OFO website. So if you look here, when you go to the OFO website, you just see kind of our introduction information here. And then when you click on each of these little bars, it opens up and you can see the family meeting materials. This is the document about preparing them. Here's where you access the video of how to access, download, and print the materials. We have a binder cover if folks want to print the materials out and put them in a 3-ring binder. We've given some suggestions in the preparing your materials document as to how different people have arranged their materials. Each of the individual tools, so the person with care needs version and the care partner version, and the family meeting guide. So when you click on this, it opens up the PDF of that material, and then you're able to download and print those. One of the things that came out of the pandemic that was not something we were expecting, originally we had developed these to be printed and then written on, but during the pandemic, families weren't able to get together with each other and actually sit in person. So we added a fillable PDF feature so that you can actually, once you download, actually the guide is a bad example of that. Let me go to one where we actually fill out here. So we'll say the care partner version. So when you can click on these and you can actually type within the boxes, and you can do that throughout. So as you're going and looking through the materials, you have the ability to check mark as you're going through, and then also type in some short notes and sentences. So that is something that came out of the pandemic that we weren't expecting, what was certainly an improvement and something that we were glad to be able to do. The other options here on the website, so the videos are here to be able to play straight from here. All of the tip sheets are located on the website. And again, you click on them and it opens a PDF. And then under these other resources, we have the Caregiving Resources Booklet, the All About Me. We also have an engagement calendar, and this was also created out of our feedback about making sure that we prioritize social engagement for the individual with care needs and also for care partners. So trying to take a look at, if you really look at this kind of in a week format and you see how many empty spaces there are for people in terms of social without anything going on. And now we can see this. It's a kind of a visual representation of this for us. The materials for professionals are here, where the guide for professionals, and then these promotional materials. So we have some flyers and then social media squares. And then the feedback. So you can actually give feedback as a person with care needs, as a family member or a friend, or give feedback as a professional. So we really encourage anyone who utilizes the materials or takes a look at them. If you have any thoughts to share with us, this is a great way to do that. And we encourage that because we'll be looking to make further developments as we secure additional funding, hopefully, to continue this work. So I'm going to go back to our PowerPoint here for a moment. And so that's our website. And then my contact information. If you'd like to get in touch with me to talk further about this, I'm happy to do so. And some references are included here, but then questions. So why don't I stop sharing, and then we can have some conversation and discussion or questions if anyone has any for us.
Jennifer, someone asked in chat, will the slides be available later?
Yeah, we can certainly, if you'd like to receive the slides, why don't you just reach out to me by email. I'll send them. I don't know that we have a mechanism to send them out. We could probably send them out to everybody who attended, actually, if you're interested in that. But if you don't want to receive the slides, I don't want to bombard you with email. So if you'd like, feel free to reach out to me, or we can look through the attendees list and send those out.
Jennifer, I just wanted to say how impressive all this material is. It is so exciting, and I'm already planning to use it.
Thank you, Angela. Well, and it's funny, and Kathy can probably attest to this too, is, we were doing some early presentations around this when we were in the pilot work, and we'd be talking to groups of professionals at conferences, and inevitably someone would say, I needed this when my family, when will this be available? When will you be able to put this out? Because I needed this with my family members. And, as a caveat too, we also understand that not every family is going to use the entire process. They might find pieces and parts of it that work for them. They might find some resources that are helpful to them. My personal feeling on this is, we're not looking to solve all of the world's problems here. We are looking for any available resources that we can provide for families and for individuals with care needs that will make that situation and arrangement a better situation for everybody involved. So if this is one piece of how that happens, we'd be very pleased with that.
Well, kudos.
Sorry, this is Sarah. So I appreciated your comment about the need for social engagement for individuals living with dementia. One of the things that I've noticed with my mother, who is living with dementia, is that many people that used to come around to socialize don't come around anymore. And so I wonder if you've thought at all about how to help people maintain relationships with friends, and even some siblings don't come around much anymore, to encourage social engagement.
That sounds like the makings of a fantastic tip sheet for our resources, because I agree. That's something we hear a lot. And the individuals who were living with dementia who participated as reviewers, we connected with them through an organization called the Dementia Action Alliance. And they are an advocacy group for individuals living with dementia, and they host community online forums in particular, where individuals living with dementia can connect with each other. They had a lot of really great feedback in terms of, people just kind of drop off when you receive this diagnosis. It's like there's kind of a line in the sand of before and after, and even people you've known for a long time stop speaking to you, don't know what to say when they visit, don't know how to connect with us. So I think, some future iterations of this work would be to think about a way of helping people maybe have some tips on how do I stay engaged with someone who I care about when I may not always know what the right thing to say is or the right thing to do. So thank you, Sarah. That's a great suggestion.
Great, thank you.
Other comments or thoughts? No? Okay. Well, I am certainly available at any time if folks would like to talk about the resources or have some suggestions for us. If you do go to the website and you look through the resources, please give some feedback. We're happy to receive it. We don't currently have funding at this time for the project for any further work, but it's always something that we're open to and thinking about in other ways. So please feel free to send any information our way if you'd like. And I thank everybody for joining us today. Hope you have a great weekend.